Hi gang, and welcome to Unit 16, where we're going to talk about the tapeworms or the flatworms. These are also known as the cestodes. So let's go ahead and move on to our second slide. Let's go ahead and talk about the characteristics of cestodes, okay? First of all, they're flat and ribbon-like, and they often look like a tape measure, which is why we call them tapeworms. They have flattened bodies with no body cavity. They lack a digestive tract, and the nutrients are all absorbed through the skin. They also have a scolex. The scolex is about 2 millimeters in diameter, and it is the mode of attachment, how the worm actually attaches to the host. Then they have proglottids, and proglottids are body segments. That the gravid proglottid is the most mature, and it's the farthest from the scolex, and usually that is the one that is the most mature, so it's one at the very end, and it contains eggs in the uterus. Also, tapeworms may have a neck. They are hermaphroditic, okay? So the male and female sex organs are in the same worm. It is a complex life cycle with both a definitive host. The definitive host harbors the sexual stage, and intermediate host, which harbors the non-sexual stage. Remember, as we're going through the cestodes, to remember the scientific and common names. Now, the cestodes are pretty small, ranging to very large in size. They can range from a few millimeters to over 20 meters in length. So here on this slide, what I've done is I've posted the scientific names for all the tapeworms we're going to talk about in this unit, and then also the common names, okay? So make sure that you're familiar with both. Taenia saginata is the beef tapeworm. Taenia solium is the pork tapeworm. Hymenolepis nana is the dwarf tapeworm, and actually nanos means dwarf in Greek, so nana means dwarf-like. Hymenolepis diminuta is the rat tapeworm. Echinococcus granulosus is the dog tapeworm, and finally we have Diphyllobothrium latum, which is the fish tapeworm. Okay, so the scolex, as you can see in the top two images, is the anterior end of the tapeworm, or the mode of attachment. The Taenia worms, or any of the worms, are going to attach to their host via the scolex. The scolex either has suckers or hooklets or both. A proglottid is a segment of tapeworm. Each one contains male and female reproductive organs when mature, and you can see the reproductive organs in the proglottid on the bottom image. Let's go ahead and first talk about Taenia saginata, which is the beef tapeworm. You can see that it has suckers only in its scolex. Okay, this particular tapeworm is found in meat-eating regions of the world, and it may get very long at 5 meters. Usually within that 5 meters, there's about 1,000 to 2,000 proglottids. The proglottids are long and narrow and have branching lateral arms. They usually have greater than 15 uterine branches per proglottid. And on the scolex, they have 4 suckers. Some symptoms of having Taenia saginata would be things like early asymptomatic, could be the first step. Then you could have diarrhea, weight loss, appendicitis, and that's because the proglottid has lodged in the appendix. So those are some signs and symptoms of Taenia saginata. So let's take a look at the life cycle of Taenia saginata. The ova are eaten by the intermediate host, that's the cow, and the ova are also found in the environment. Okay. The embryo hatch and penetrate intestinal walls of the cow and are carried to the tissue via the bloodstream. A cysticercus larva starts to develop inside the cow. A cysticercus is a larval form surrounded by a fluid-filled sac. It's a small bladder and sac that is filled with one invaginated scolex. The cysticercus larvae are eaten by the human in undercooked beef. That's the infective stage, when they eat the cysticercus larvae in undercooked beef. The scolex then attaches to the human host, which is the definitive host, and matures in the small intestine. Ova and proglottids are passed in human feces, and that's the diagnostic stage. The scolex is liberated when the bladder is digested by the human host. Then the scolex attaches and grows proglottids. Keep in mind that the life cycle of Taenia solium is exactly the same, except for it is hogs as the intermediate host. Taenia saginata ova are usually kind of oval and about 35 to 45 microns in diameter. Sometimes you can see radial striations in the ova, and sometimes you can even see hooklets inside of the ova. These ova are small to medium size at about 30 to 50 microns, and they have that thick outer shell with radial striations. You may see the hooklets in other species like Taenia solium. These ova can be darkly pigmented from iodine or biosalts, and you may get them confused with pollen granules. Pollen granules can look large and striated as well. So this is the ova of Taenia saginata. We're usually going to be able to diagnose this by finding the ova in stool or finding the proglottids in stool. Taenia solium is the pork tapeworm. The cyst can actually lodge in the human brain of the host. Now this never happens with Taenia saginata, but it does happen with Taenia solium. The adult can reach 3 meters in length with about 1,000 proglottids or less. Lateral branches in each proglottid are going to number about 7 to 13. They are less than 15. They attach to their host with suckers and hooklets, and the ova is indistinguishable from that of Taenia saginata. So the ova of Taenia solium and the ova of Taenia saginata look exactly the same. In the case of Taenia solium, the intermediate host is the hog or the human. And again, the life cycle of Taenia saginata is completely the same, except for there's a different definitive host. Okay? Humans are actually the only definitive host for both Taenia species. The worms can live inside of their human host, but usually you only see one worm per person. That's a little bit different than the roundworms where the host may have several worms. Let's move on to the next slide where we talk a little bit more about Taenia saginata and Taenia solium. If you're having trouble identifying your Taenia down to the species level, what you can do is take a look at the proglottids, okay? You can actually take those proglottids and diagnose by squeezing a stained proglottid between two slides. Hold it in front of a strong light source and count the number of uterine branches to speciate. Taenia saginata has 15 to 20 lateral uterine branches per proglottid, and Taenia solium has far less at 7 to 13 lateral uterine branches per proglottid. Remember, Taenia saginata is the beef tapeworm, and Taenia solium is the pig tapeworm. The most prevalent worm in the United States is Hymenalepis nana. This is also known as the dwarf tapeworm. It's usually found in warm climates, and it is the smallest human tapeworm at about 25 to 40 micrometers. There's usually about 200 proglottids per tapeworm. This particular tapeworm attaches to its host via suckers and hooklets. There's actually 3 pairs of hooklets on Hymenalepis nana. The ova are plentiful in stool samples. They have a fragile terminal gravid proglottids that detach easily and spills the ova into the feces. They have larval and mature stages are found in the same human host, and there is no intermediate host. This is actually transmitted from human to human. So let's take a look at the ova and the life cycle in the next slide. The life cycle of Hymenalepis nana is as follows. The ova is ingested by the human, that's the infective stage, ingesting the ova. The ova hatch inside the duodenum. The cysticercoid larva forms, so that's a larva inside of a cyst. Then the larva attaches to the mucosal lining of the intestine. It matures on the mucosa, and ova are released from the gravid proglottids. Ova are passed in the feces, and that's the diagnostic stage, or ova hatch in the GI tract, causing auto-reinfection. You'll notice in the image there we have a Hymenalepis nana. They're about 30 microns in width and about 50 microns in length. They have a pale thin shell, and if you look very closely you can see 4 to 8 thread-like filaments that may be seen from each polar thickening. Okay, these filaments come from the polar nubs that you can see. Now, people that have Hymenalepis nana can be asymptomatic or have abdominal pain, anorexia, which is loss of appetite, and headache. Hymenalepis diminuta is the rat tapeworm. The adult worms are 20 to 60 centimeters in length, and usually we have 1,000 or a few more proglottids. It attaches to its host with suckers, and there are no hooklets. You'll notice in the image that they're a little bit larger than Hymenelepis nana at about 60 by 85 microns. You'll also notice that the ova has a yellow pigment in its medium size, and there's no polar filaments attached at the polar thickenings. Okay, so this is Hymenelepis diminuta, and you can see the scolex of the Hymenelepis diminuta in the image on the right. Here we can take a look at the life cycle of Hymenelepis diminuta. The ova are ingested by fleas and beetles. These are the intermediate hosts. Rodents actually eat the infected insect and pass infected feces to humans who eat the rat feces contaminated items. So the beetles are the intermediate hosts, okay, are fleas and beetles, and rodents are, of course, one of the hosts as well. Fleas and beetles can be in grain or flour and then be ingested by humans or rat feces, okay, or you're ingesting the rat feces. The larva matures into an adult worm in the human, and the ova can be passed in the feces, and that would be the diagnostic stage. So as you can see, the image on the right shows a larger Hymenelepis diminuta ova next to the Hymenelepis nana ova. Hymenelepis diminuta is quite a bit larger than Hymenelepis nana, and you can compare the two because Hymenelepis diminuta is on the left and Hymenelepis nana is on the right. Fun fact, beetles infected with Hymenelepis diminuta are still able to learn things, but were actually quite sluggish in a study conducted by a few entomologists. Let's go ahead and compare H. diminuta to H. nana in the next slide. So here's a nice comparison of Hymenelepis diminuta and Hymenelepis nana. You'll notice Hymenelepis diminuta is larger. It is more rounded and has no fibrils, and it usually stains a yellow pigment due to biosalts. Hymenelepis nana is more oval-shaped in appearance, and you will notice that there are fibrils present at the polar ends inside of the cell wall. Diphyllobothrium latum is probably one of the most difficult organisms to spell. This is the fish tapeworm, okay? This fish tapeworm has worldwide distribution and is transmitted via improperly prepared fish, and that's from pickled fish or improperly cooked fish. It actually is endemic to the Great Lake region, Minnesota and Michigan. They can be rather large at about 10 meters in length, and that would include about 4,000 proglottids. It has a characteristic spoon-shaped scolex, and you can see that in the image on the right. The scolex here is enlarged and spoon-shaped. In the life cycle of D. latum, ova are passed in the feces and end up in fresh water, or human feces to water. Okay? The Coracidium larva hatch from the ova and into the water. A Coracidium larva is just a fancy word for a ciliated larva. The larvae are then ingested by the water flea or the cyclops, and the water flea is the first intermediate host. The procercoid larva develop in the cyclops. The procercoid larva is larva that develops inside of a fish. The pleurocercoid larva develop in the fish muscle, and that is the infective stage. Okay? Undercooked fish muscle is ingested by the human. That's the infective stage. The scolex attaches in the small intestine and develops to maturity. That's the infective stage. Ova are laid by mature larvae and passed in the feces, and that's going to be your diagnostic stage. For Diphyllobothrium latum, some symptoms would be appearing anemic because the worm actually absorbs host vitamin B12. Diphyllobothrium latum has an interesting shape to its uterine branches. It's actually rosette formed, and you can see that in the image on the left. There is an operculum visible on the ova, and an operculum is basically a escape hatch for the worm that is inside of the ova. You can see it on the bottom left in the image on the right. You can see where the egg has a little hinge where it's going to open and liberate the worm inside. The ova are about 50 to 70 microns, and they will take on biosalt pigments as well and will become yellow-brown. They're usually about 70 microns in length and about 50 microns in diameter. Sometimes humans come in contact with infected animals and they develop what's known as a zoonotic human infection with Cestoda. A good example of that would be Echinococcus granulosus, where you're exposed to the dog tapeworm, Taenia solium, where you're exposed to the pork tapeworm, Hymenolepis diminuta is the rat tapeworm, and finally Diphylidium canium, which is the dog or cat tapeworm. Humans are usually acquired these zoonotic infections from close contact with those infected animals, including the accidental ingestion of the larva or the ova. Echinococcus granulosis is, in this particular tapeworm malady, the human is the accidental host. Humans ingest eggs with close contacts with infected dogs. It's the canine who is the definitive host to the adult worm. The worm is pretty small at 0.6 centimeters, but there is present a scolex, neck, and 3 proglottids, and you can see that in the image on the right bottom. The ova are similar to Taenia species as well. Now here we are looking for the hydatid cyst that develops in the lungs and liver of the accidental human host. The human may get liver or respiratory failure. The diagnostic stage is by seeing the cyst in tissues. And that's the hydatid cyst on the upper right. The life cycle of Echinococcus granulosus is pretty self-explanatory. The adult worm lives in the dog intestine. The ova is passed in dog feces. Human ingests ova from close contact with a dog or other herbivore animal that are typical intermediate hosts. And they ingest ova from pasture contaminated with dog feces. A hydatid cyst develops in the tissues of the intermediate host, and you can see these hydatid cysts in the liver, lung, or other tissues, and that would be the diagnostic stage. The viscera of infected herbivore eaten by canine, the cyst develops into an adult worm. Okay. Here I have a chart for you where we can compare our tapeworms, intermediate hosts, mode of infection, and method of diagnosis. So Taenia saginata, the intermediate host is cattle. The mode of infection is by ingesting undercooked beef, and the method of diagnosis by seeing the ova and stool or proglottids as well. And you might see the proglottids and stool as well. Taenia solium is the pig tapeworm or the swine tapeworm. Here what's happening is that the large larva is ingested in undercooked pork, and the ova and proglottids or the scolex are found in the feces. In Hymenolepis nana, there is no intermediate host. The ova are ingested or auto-infected, and we can examine the stool for Hymenolepis nana. Hymenolepis diminuta, the intermediate host is fleas and beetles, okay, not the rat. The ova ingested in foodstuffs is usually that's the mode of infection. And stool exam for ova and parasites may lead you to the identification of H. diminuta. Dilatum, its intermediate host is the water flea, and then freshwater fish. A larger fish comes and eats that freshwater fish, and now it is a mode of infection. Okay. And then finally, the method that we use to diagnose Diphyllobothrium latum is by looking at stool exams that have been preserved in formalin. And you'll notice the stool exam, we're looking for operculated ova or proglottids. In the case of Echinococcus, we're looking for the hydatid cyst in human liver, lung, and other tissues. So that's kind of a comparison of your tapeworms with their mode of infection and method of diagnosis. And that's it for the cestodes. It's never good when you see a sign that says, "We have worms in the rear," but that's probably a bait shop. Okay, bye-bye.